Hello, everyone. Welcome to Impact Hub Geneva. I'm Santu Boethius. I'm one of the co-founders of Impact Hub Geneva and our global program, Accelerate 2030. And I'm really honored to have you all here, all the people in physical presence, and also everyone that is following this event on the live stream. Welcome. Before we start, I wanted to get a little hands up of for whom is it the first time in the Impact Hub? Is there any newcomers? There's a few of you. So welcome to the Hub. Just a couple of words about Impact Hub. We are part of, would say, possibly the largest network of communities for entrepreneurs that are working towards the SDGs around the world. We have locations in over 100 cities over all different continents. And so once you've been in one hub, you know that you can go and join and visit any Impact Hub around the world and feel welcome. So welcome. And I will, yes. So here we are. Before we'll start, so a little bit of background of what takes us here today. This is a very special week for us. At Impact Hub Geneva, we have founded one of the largest programs supporting entrepreneurs across the globe, particularly entrepreneurs in Africa, Asia, Latin America, and Eastern Europe. And this week here now, we're kicking off the global phase of the program. We have over 1,400 applicants that have joined Accelerate 2030 in this year and supported over 200 entrepreneurs. And today, the top 15 are here in Geneva, and you will hear from three of the entrepreneurs here today, and this will be super exciting. And then we have a little special guest as well from Brazil, who joined the program in our last edition. So very exciting to be joined by people from really all across the world. So that's very unique in today's world where traveling as such is not so self-evident. Before starting, I do want to really thank all our partners, especially the Swiss Development Agency that has made this program possible. Also our partners from Pfizer, Intent, Baraka Impact Finance, and Impact for Breakfast that's made this event possible here today. And before moving forward on this really important theme, we're going to hear, I wanted to say that really our mission with the Impact Hub here and with Accelerate 2030 during this special week of building bridges is a call for urgency that we are directing enough financing to some of the real key doers on the ground, the entrepreneurs that are in the global south and across the developing markets and emerging markets that are doing amazing work and are coming up with solutions for the SDGs. That there is enough financing that us here sitting in this room here in Geneva with our networks and others are looking, how can we support some of these entrepreneurs? So that's our core from us today. And before going on into the details of the event, I want to introduce us to our beloved moderator expert on the topic, James Baer. He is the managing director and partner of Baraka Impact Finance. He's also sitting as our health advisory expert member in Accelerate 2030 and supporting us in our work. So he will give you a good hands-on. You're in good hands today. Enjoy this moment. Thank you.
Thank you, Santu. Is that clear? Yeah. I like being beloved. Thanks for that. Really feels good, right? First of all, it's a pleasure to be here. I'm really honored to be part of the Swiss ecosystem, the Geneva ecosystem around sustainability, and specifically sustainability and health. It's an amazing environment to be with so many people of like mind. And last night I had the privilege of attending the UNAIDS Health Innovation Exchange dinner, and I don't know how many people were there, maybe 40, 50 people. And we are all speaking the same language, knowing the incredible importance of addressing health innovation, supporting health innovation through not just capital, but through technical assistance and through goodwill, and how urgent it is. So I am a little bit afraid, having had that event last night and sat in a really interesting session prior to this one, that I'm preaching to the converted. I'm afraid everything we're going to talk about today are things that everybody in this room already knows about. So I hope I'm wrong, or that, you know, maybe I'll say it in a way and we'll have our panelists contribute in a way that adds value and enhances your own perspectives on health innovation at this incredibly important juncture in our world history that we're all living through. Also, something you should know about me is I've been in healthcare for about 30 years. And I started in international context, and I'm not going to go to all the details in there, but a lot of those years were spent in Asia. So I was there as an adolescent and a young adult, and then I went on and did professional work there for many years. I am not clinically trained. I think about the business of healthcare. I think about unit costs. I think about how we deliver accessible care that's equal and that's sustained and that actually presents business models that we can live with and grow. That's been my entire 30-year orientation, is thinking about the business of healthcare. So you'll always hear that from me as we go forward. What you'll also hear from me is my enthusiasm for what I think is an era of opportunity. And we are smack in the middle of it. And, you know, we all look around for the silver lining of this, you know, awful pandemic. And there's one that's very obvious to me on a day in, day out basis, and I think to many people here. And that is now a public understanding about what health systems are. Some shared ideas about what needs to happen in order to guard against the failures that we all witnessed in the last 2 years and that continue to plague us today. I'll tell you, we could put a lot of people to sleep with that conversation 3 years ago, and not so much anymore. You get to actually have dialogue, and you get to have people, even without a health background, who are starting to understand we have large systemic issues that need to be addressed. I think what's also maybe somewhat surprising is that among the global health stakeholders, and I would include large multilateral agencies, philanthropic entities, ministries of health, and those of us who've worked in the field for a long time, I think there's more and more of an alignment of priorities because of the pandemic as well. Once again, we're speaking the same language, and I would cite three kind of themes on where I see alignment and agreement. I realize I have this really great slides to go with this. Okay, there we go. Perfect. So this is the era of opportunity. And these are the three, and we can go 2 more times. And these are the three indications of this era of opportunity. So the one I'm speaking to right now is the alignment of global health stakeholders on what the priorities must be. And I would say there are at least 3 of them. First of all, we need systemic solutions. We can't keep going in with shots in the arm, excuse the pun, and expecting everything to get better. We've got to look at ways of addressing gaps and finding sustained models. So there's an incredible set of kind of principles that we now take into every conversation about every global health intervention. Can it be sustained? Does it address systemic problems? What systemic problems are going to plague this intervention if we don't address them? Secondly, that interventions that make a difference must have leadership of those people who are being impacted by that intervention. You need local leadership, you need local voices at the table, you need engagement with the communities, the cultures, the cities that you're deploying your solution in. As soon as you leave those voices off the table, mistakes are bound to happen. And I think there's a real consensus around that now. And even the most sophisticated philanthropic agencies, you know, who are, you know, in many ways it looks like are throwing money at problems, are also looking for this kind of engagement from those who are most affected by whatever solution is being offered. And then thirdly, and this may be modestly more controversial, I think there's an agreement about the incredible importance of public and private sector collaboration in order to make real change. So we know that the public entities themselves, be they the ministries of health or national governments or certainly local governments, they can't do this. They can't make these huge improvements that are required to health systems without public sector engagement. So a lot of what we do at Baraka Impact Finance is focused on private sector entrepreneurs, and we have some great examples of entrepreneurs with us today who are going to show their stuff and why it's so exciting, as well as private investors. And we know that we won't be able to address the funding gap, nor can we address the technical assistance gaps, nor can we really make the kind of changes we need without public-private collaboration. So I would say those three themes are ones that generally when you're in a room together with a bunch of global health stakeholders, you don't have much disagreement about. The other two things that you'll see up there on this, oh, no, don't go there yet. Thanks. The other two things that you'll see on the screen that I think are real indications of why we should be optimistic is the incredible acceleration of technological advances that have direct bearing on low resource settings. Low-cost medical device development, mobile-based care access, AI-driven clinical decision support tools, data management, cloud-based data management. All of these have taken leaps and bounds in the last 2-3 years. And so many of us who've been thinking about problems of delivering equitable care in low-resource settings for many years frankly, our heads are spinning at how quickly there are now technological solutions that are available. And thirdly, and maybe most exciting of all on a day-in, day-out basis for me, because I talk to a lot of entrepreneurs all the time, all over the world, is the concentration of knowledge capital. So something's happened, and we can map it demographically, what's going on. But what we've got in the field today, the individuals, for example, sitting here with us in the room, who are driving innovation is just a lot of brains and a lot of enthusiasm, and it's a diverse set of skills. One of the chronic problems, in my own opinion, and believe me, some of my best friends are doctors, is that we used to assign all the leadership to physicians, and for some physicians that worked out great. They had all those skills. That were beyond just their clinical abilities or their scientific skills, and they were able to bring value to the table. But you can't put the kind of change that we need within global health systems only on doctors. They have to be part of it, and they have to be mixed with smart business people, with smart data scientists, with smart engineers, technologists, and public health experts without clinical training. It takes all those skills. And when we get into the weeds with the innovators who are on the Baraka pipeline, we find this incredible concentration of knowledge capital. And I think it's differentiated. So again, I spent many years in Asia a long time ago, right? So in the 80s and the 90s, we still, even at those times, and Asia was going through tremendous change, and I was, in the five tigers who were going through incredible economic growth at the time, you still didn't have this sensation of kind of dispersed intelligence on multiple levels and from multiple sectors. So that's what's happening, and that's what's driving the innovation. And for those of us who are not innovating ourselves and we want these problems resolved, we need to take notice. And we need to figure out how to line up the support that these innovators need in order to significantly contribute to scaling solutions to global health problems. So let me see how, now you can click. Thank you. So I think the question for all of us, this is the critical question and a hard one, is whether we can optimize the potential gains of this era of opportunity by making sure that resources, and I mean that broadly, resources are aligned to support innovation. And I'll tell you where the clouds are, so if you can go on, please. First of all, we've all seen this figure, and in just the session before this, it was quoted again. There's something in the neighborhood of a $370 billion annual price tag, and if you go to the next slide, we see that the cost to fund this for the world's poorest is, oh, look at that, there's a typo there. It's $370 billion, and we know only about $140 billion comes from existing forms of foreign assistance, and that leaves a $230 or $40 billion price tag. That has to be funded. Once again, I know I'm restating what all of you already know, but that's why private capital must be engaged. And then we know that stimulating just 1%, that is catalyzing just 1% of what's circulating the planet at any given time in private capital could actually meet that gap. There's a great report that many in this room will want to read. I don't know if one of the editors of that report, Hamza Shad, he was going to be on from New York today. I'm not sure if he's in the virtual audience, but he interviewed myself and Audrey Sanghi, co-founder of Baraka, for this incredible report that will be published and be available to all of you within the next week or two, I think. It's very imminent. But a couple of things that come out of that. A survey of innovators and of support organizations that show an incredible disconnect with something like, what did I put down here, 75% of companies being in what we would call growth stage. So these are innovators in developing regions who are at growth stage. And the support organizations that are there for innovators are, what did I say, less than 5% of them are focused on growth stage companies. So we have a huge disconnect. And I think this has been our experience at Baraka, is not only are there a lot of innovators out there, there are a lot of innovators with mature business models who have been in the market for 2 years, 3 years, 5 years, 10 years, and are now ready to scale and needing capital. So we have a disconnect planetarily between support organizations and what it is that innovators need in order to grow. And then another survey that came out of that same report that I'm sure you're all going to want to see is an incredible disconnect between the types of support, or rather the amount of support given to innovators based on whether they are expatriates operating in a lesser developed region, returnees, those who've been educated abroad and are returning to their home country, or locals. India's done a better job than has sub-Saharan Africa in spreading out that support between locals and returnees. They don't have so many expatriate leaders there. But in sub-Saharan Africa, it's all cockeyed, right? We've got way too much support going for expatriates and not nearly enough going for local entrepreneurs. So these are problems. This is a misalignment of resources to really take advantage of the opportunities of the era. And then if you could go on.
Well, I'm pleased to say that joining me now live from Abu.
So I'll stop you for a minute. This is kind of hard-hitting. This was just from 3-4 days ago on BBC, and I only grabbed a little bit of it. But I think what it says, and I'll stop here, I think it shows how significant the fragmentation continues to be around global health. Watch her, it just takes a minute.
Well, I'm pleased to say that joining me now live from Abuja is a co-chair of the African Union's Vaccine Delivery Alliance, Dr. Ayowade Alakija. Dr. Alakija, thank you for your time. Do you feel that this was inevitable in some way?
Thank you, Philippa. It was absolutely inevitable. And may I say firstly that had the first SARS-CoV virus, the one that was first identified in China last year, originated in Africa, it is now clear that the world would have locked us away and thrown away the key. There would have been no urgency to develop vaccines because it would have been expendable. Africa would have become known as the continent of COVID. What is going on right now is inevitable. It's as a result of the world's failure to vaccinate in an equitable, urgent, and speedy manner. It is as a result of hoarding by high-income countries of the world. And quite frankly, it is unacceptable. These travel bans are based in politics and not in science. It is wrong.
I hear your...
She says, I hear your anger, is what the newscaster says. Oh, sorry. I found that really moving, and it goes on. She's extremely compelling, but I don't want this session today to focus on vaccine distribution. We have some other topics that we're covering, so that's not the purpose of bringing this up. It is only to say this level of fragmentation, this level of siloing, this separateness that we continue to have in global health solutions is problematic, and we've got to address it. So I'm going to stop there now, and we're going to have our innovators come up and give you each a 3-minute pitch on their really exciting companies. And then we will have our panelists join us, 2 virtually and 2 here in the room, and we'll move into our panel discussion. So.
Thank you. Good afternoon. It's surprising how, after decades of progress, malaria cases are on the rise, not just now, but for 6 years. More than 1,200 deaths, lives are being lost every single day due to this preventable disease. It was 2011, I had a job with a textile company in India, and I was on a work trip to Kenya, and I found myself in the funeral of a 4-year-old child. And I was shocked to hear that she died from a mosquito bite, and that too from a hole that was in the bed net. So coming from a textile background, this was unacceptable for me. I left Kenya that trip, changed as a different person, determined to do something about it. And I was fast forward 5 years, I was back in Kenya, this time along with my business partner Danielin, meeting with the Ministry of Health, discussing their malaria elimination strategies. From that time, there has been no looking back. Listening to WHO's clarion call to develop products that are sustainable as well as scalable, to overcome the resistance challenges, Lancet developed a very unique 2-track process, of which the first track focuses on improving the present technologies. As most of you might know, treated bed nets is one among them. And the bed net which we have developed has dual active ingredients, one on the roof and another on the side walls to fight resistance. So this is achieved through a patented microencapsulation technology. And on indoor residual spray, our product currently lasts for 18 months, which is twice as much as any other existing product in the market. And we are also looking long-term on active ingredient discovery projects because we know mosquitoes get resistant very quick. So we've been screening natural compounds. More than 200,000 compounds have been screened, and 14 have been finalized for scalability studies. All of this would not have been possible without a diverse team of entrepreneurs and scientists who have made this happen. And we also have partnerships with industry leaders and research partners, among which the Bill and Melinda Gates have funded quite a significant part of our work. On past funding, we have raised more than 10 million euros, along the way achieving significant milestones all the years. On our research and development part, we've well past the risk stages, the initial 5 to 7 years, and we are very close to market entry. And 2 out of our 4 products are scheduled to enter the market in 2023. I have some issues with the clicker. Okay. So the market size of malaria prevention is at $2 billion. And established buyers, as all of you might know, are the ministries of health, global donors, and a very small part is retail. And phase 1 of our market entry is planned among the top 10 malaria burden countries, especially in sub-Saharan Africa. Our current ask is for 17 million euros in equity and loans. 12 million goes for an acquisition of an existing competitor's portfolio, and 5 million for the final phase of R&D to get our products to market. As I mentioned, there are 1,200 registered deaths every single day, and more than 75% of them are children under the age of 5. Every life is precious. Every life has potential. Seeing them lost to a disease that is preventable is not acceptable. Join together and let us be the generation that is known to consign malaria to the history books and create a malaria-free world. Thank you. Thank you.
Who's next in our group here? Happy.
Hello, everyone. My name is Biganza Papi. I'm the founder of Alfie Pharma. Alfie Pharma is a pharmaceutical e-commerce platform that makes medicine more affordable and easily accessible to billions of people across Africa. Why I'm doing this today? I had my grandfather who lived in a rural area alone. He died in 2019 with asthma because the medication was so expensive and he couldn't get to the city to buy medication. I created this company. We want to ensure that everyone has access to medication at any time and everywhere. We have a website, we have a mobile application. We are integrating the USSD code in our system because in a rural area there is a low internet penetration, so that we are doing that because people in rural areas to have access on our menu of medication with a simple phone without internet. The market size in Africa, the pharmaceutical market size in Africa is 20 billion, while the pharmaceutical market in Rwanda is 165 million. What is our target market? Our primary target market are people with chronic disease, such as chronic cardiovascular disease, chronic respiratory disease, and diabetes. Why? Because they need a daily drug treatment. They require a pharmacological therapy every day. Our secondary target market are people living in the rural areas because they are underserved. Those people who travel a long distance from rural areas to Kigali or to urban areas to find the medication they didn't find to their local pharmacies. You might be surprised that the population of Rwanda is 13 million. However, 80% of the population is living in the rural areas, and we have only 117 pharmacies in the rural area. What is our competitive advantages? We provide affordability, 20% discount on medication, and we provide as well convenience and privacy. And in terms of traction, we have helped over 2,000 pharmaceutical and parapharmaceutical. We have secured an FDA license, which is very difficult to obtain in my country. Currently, we are asking 150,000 to help us to expand our user base from 2,200 to 200,000 user base. Thank you very much.
Wonderful. Cool. All right. Hi, everyone. That's a very good point. These masks, they should make automatic ones. Awesome. Before we start, I want everyone just to take a deep breath together with me. Let's do it. Now, do you guys know what was in the air you just inhaled? Because when I was a kid back in North Macedonia and Skopje, I didn't. And I didn't care. I took clean air for granted, as much as we all do. But the truth, unfortunately, was quite far away from that, because this is my home city of Skopje. I can assure you the city is there. Unfortunately, you can't see it because of all the so-called smelly fog. And it was only by accidental university research that I discovered that my home city was polluted 20 times over EU limits, 4 times over Beijing. I mean, that was ridiculous. That was crazy. That was unbelievable. But why wasn't anyone talking about it? Where was the media? Where were the social posts? Where are the people on the streets? It was silence. I couldn't stand by and watch that happen, not to my home country, and especially because this was a bigger problem. And it was no longer just with me, because 7 million people die annually from exposure to air pollution all around the world. So I decided to do something about that. Using my technical knowledge, because I'm a geek by nature, I decided to create AirCare. AirCare is a mobile app that aggregates air pollution data and lets you know exactly what you breathe. We work in a very simple way. We look for open air quality sensors that belong to governments, volunteers, and even satellite data from the European Space Agency. We put it all together in a single platform that, in the palm of your hand, helps you know what the air quality is right outside your home. Once we launched this in North Macedonia, it went a bit crazy. We had members of parliament waving screenshots of the app, demanding greener policies. We had people on the streets protesting, saying we need clean air. And we had corporates being outfitted with filters in order to stop air pollution from being emitted. And this was tested out not only in North Macedonia, but in Serbia, and we had the exact same effect a couple of years later. We've reached 1.8 million unique people with our app and are aiming to reach over 7 million throughout the years. And over 100 media mentions have talked about the work of AirCare, let alone 20 national and international awards, including those from the UN, for our work. We're not the first ones to create an air quality app, but some of our competitors that have been funded 15 million, well, they only see red pollution in Skopje. But this is what we see. We're able to pinpoint exactly where air pollution is coming from and help both local governments and activists take action. We're already profitable, making 7K a month from a B2C model, from ads, product placement, subscriptions, and working with air purifier manufacturers as well. But we want to expand our B2B sector and work more with all of the data we've created. 45 countries is where we're live now, but 150 face air pollution issues, and only we can get there with your help. We're looking for partners with eco-connections and a passion for clean air, and 200K investment to expand our team within the US and APAC markets. My name is Gorjan. We have a great team with 30 years experience. But before I leave you, I want to just tell you, you think you're breathing clean air in Geneva? Maybe check the app. So let's save 7 million lives. Thank you.
Hello, everyone. It's a pleasure to be here. I'm Pedro, CEO and co-founder of EP Health, and we are connecting people and leveraging health science. Basically, if we look to the whole health system, in one hand, we have the whole population who needs treatment. In the other hand, we have scientific companies who develop those treatments, but needs people. And why is that? What's the missing point? Basically, there's a long and not connected journey between them. This journey doesn't start at the treatment point. We have the disease awareness campaigns, we have the diagnosis journeys, then we access treatments. Basically, if we look to the most conditions like diabetes, hypertension, stroke, cancer, rare disease, they have a pattern. By the end of the day, we have low rates of treatments and high cost to develop new treatments. And basically, but basically, because it's a little bit brighter, but because we have been only focused in the hospitals for the last decades, and what COVID showed us, that the hospitals came to us and say, if everybody come to the hospital at the same time, the system is going to collapse. So if the hospitals were not made to manage the whole population, how can we do that? And that's where EP Health came. We had a little bit issue there. So basically what we have in EP Health, to simple that, we have EP Social. It's a platform for community health workers where we achieve already more than 4,000 cities in Brazil. We can go to the most vulnerable places, like in the middle of the rainforest, slums, in the borders. It's really, really massive, our reach, performing already more than 500,000 visits, home care visits, every single month. On the other hand, we have the EP Pro for cities to help them to manage their whole population health. We have already 50 cities with the platform. We have also the super app for the patient, the EPU. Then we have the EP Science working with big companies to help to apply innovation at community level. We have already reached 4 million people in Brazil, and this is some of our international recognitions that we are really proud of to be working with. So thank you very much.
So thank you. Very inspiring, and I highly recommend if you're bored with your job, spend some time talking to innovators. It's absolutely the most exciting and thrilling part of my current work. So we're ready to have our panelists come up now. So if with two here in the room with us, Andre Hoffman and Audrey Sanghi, and then I believe online, although I don't see them live right now, yes, Shannon and Darren. Nice to see you, Shannon Shabata Germano and Darren Back. Shannon, I think, is in Arizona, and Darren is currently in New York. Welcome, guys. Thanks for your patience as we move through this today. So let me start with introductions. Andre, if you don't mind, I'll start with you. So Andre Hoffman is an environmentalist involved in multiple nonprofit and charities focused on sustainability and nature conservancy. He studied economics at the University of St. Gallen and obtained his MBA at INSEAD. He currently serves as vice chairman to Roche Holdings and sits on the board of several US and European health sector companies. He's a member of the Club of Rome, vice chairman of the board at the Venture Foundation, a member of the Royal Institute of International Affairs, and senior advisor at Chatham House. That's a lot, right? And he is also a champion for One Health approach, which focuses on issues at the interface of human, animal, and environment. And he'll speak some to that today. I've also asked Andre to please speak a little on the China Accelerator program that Roche is launching just this year, and Movimiento Salud, a LATAM-focused innovation that Barack has also partnered with. Andre, welcome, and thank you for being here today.
Thank you for having me.
And I'm going to ask each of our panelists the following question. Why do you do the work you do? What motivates you to be here?
Well, thank you very much for having me. I feel a little bit like, a bit of imposter syndrome. I mean, what you just read is far too extensive. I think, we do have, and we've touched about it a couple of times today, we are in a very important period of history. We just come out from, we're just falling back into a pandemic situation, which is getting a little bit, which has been testing our system, which has been testing the resilience of the system. And we're seeing that at a moment where we have the convergence of an enormous amount of innovation, of new technologies, which will allow us to sort of look at the world around us in a very different way. And so I think it's time to sort of innovate for the future. Our pharmaceutical business, I call it our because I'm vice chairman, because my family owns the majority of the share. Our company has been successful only because we have been able to innovate as we went along. Today, the opportunities to do something new are bigger than ever. And to create the true innovation into an environment like this, you need to rely on people like the entrepreneurs we've just heard. You need to come up with new ideas, and we also need to look very seriously at what's happening in terms of healthcare delivery on the planet. And these are three of the reasons why I think it would be interesting for me to participate in this panel today, and I'm extremely grateful that you invited me.
Thank you. Honored to have you. I'm going to go back and forth, virtual and real life. So I'm going to go to you, Shannon. Dr. Shannon Shabata Germanos. She's the founder of Lacuna Advisors, an angel investor herself, advisor and consultant to investors. Her thematic areas of interest are health tech, biotech, medtech, neuro AI, interface, and personalized medicine. She has been a close advisor to heads of state, royal families, and CEOs in complex policy and business development, as well as negotiations with a special focus on global public health. This woman has been in the thick of it. Shannon holds a Master's of Science and PhD in Neuroscience from University College London, where she continues to conduct research related to dementia. She also sits on the International Advisory Group of the UNAIDS Health Innovation Exchange. I'm sorry that you couldn't be at last night's event, and I hope you're feeling well enough and really appreciate you being here today, Shannon. So the same question to you. Why are you doing the work you do, and what motivates you to do this work?
James, thanks for having me, and hi, everybody. So my husband and I have a family office based between London and Geneva, and one of the things that really motivates me is recognizing this enormous uptick in medtech, health tech, biotech-based companies that were just exploding in the last decade. And we really wanted to focus our investment thematic strategy on health innovations that were able to change the way equitable healthcare was delivered with a global footprint. And we really focus on dual market companies that are able to operate both in the global north and in the global south. And we have a little bit of a different focus. We're not just full impact investors. We really believe that if healthcare companies are built well and designed well from the outset, we can make market rate returns. We really do believe that. And so we really believe that these innovations can really generate efficiency, access, as we heard from some of these innovators earlier, cost savings, and really seamlessly integrate with clinical efforts delivered in real time. And that augments the fantastic work being done by agencies and by governments already. And some of the greatest challenges facing healthcare today is provider capacity building and connectivity, these isolated rural areas that need to be connected from a systems-based standpoint. So we think that these sorts of innovations are able to really meet those pain points and want to invest in these sorts of companies as they scale and grow. Thanks.
Wonderful. Thank you, Shannon. Darren, I'm gonna go to you. I have to first of all comment that the Christmas tree and the Buddha behind you looks like my own home. Nice to see you. Thanks for being there. Darren has more than 20 years of global health, corporate affairs, and strategic healthcare experience, and holds specific expertise in public health, care delivery, and access in low and middle income countries. He is currently the vice president for global health investments at Pfizer and the executive director of the Pfizer Foundation. He holds a master's degree in public health from the London School of Hygiene and Tropical Medicine and a bachelor's of science in pharmacology from King's College London. Pfizer Foundation has got a bunch of interesting work that they are doing in the global health sphere. I'm hoping today he can talk a little bit about the sustainability bond, which they launched in early 2020, and then grants and investment program that Darren oversees, which focuses on improving healthcare access, addressing barriers to care for women and children, and reducing the burden of non-communicable diseases. So Darren, your turn. Why do you do the work you do, and what motivates you to be here?
Well, thank you, James, and thank you for noticing my background. It's a good job I didn't put it on blur, so you can appreciate the tree and the Buddha. And thank you to everyone in the room. Sorry I couldn't be there in person, and to the great presentations we've had so far. I mean, I'll keep this brief. Why I do what I do, it's pretty much what you said, James, in terms of, I think we have a real opportunity now to look at how we focus resources and really hone in on those which are providing the biggest impact. And so much of that now is at the community level, or really at the entrepreneur, smaller organizational level. So what I see as my role is very much working with both Pfizer and the Pfizer Foundation to make sure that we're optimizing our resources and investing in really the high impact areas that are going to improve health equity around the world.
Wonderful, thank you. And last but definitely not least, I'm honored to work closely with Audrey Sanghi. She's co-founder of Baraka Impact Finance, but has many, many other accolades. She's the director of the Artha Impact, a division of Rianta Capital, responsible for deployment of capital to social entrepreneurs in India. And she's been doing that for about 15 years. She's co-founder of Artha Networks, a platform as a service to connect investors, entrepreneurs, support organizations, and service providers across markets and sectors. Audrey also founded Impact for Breakfast, which Santum mentioned earlier, and many of you may be aware of. It's 12 plus years now of bringing together those in development and those in finance into interesting dialogues across sectors around sustainable finance and innovative finance solutions. There's now got over 2,500 members and, I don't know, 19 or 20 chapters, right? 16, okay, 16 chapters. As I said, I'm honored to work closely with Audrey, and always a pleasure to do thought curing with her. She's a smart person, holds a PhD in technology policy from Tufts University. She's a Geneva native with deep roots in the US as well. Audrey, what about you? Why do you do the work you do?
Why do we do the work we do? Thank you very much for that. I have had the privilege of being one of those who works for a family. In this case, it's a single family office with a mandate to deploy capital in unique ways where we really get to test and flex what the purpose of capital really is. And in this case, it's in forming, in the microcosm, the legacy of a family. But in kind of the macro view, it's basically supporting those to build the sustainable organizations that they are designing. And I think on some level, it's a duty of care. After trying to do this work for 15 years, through the course of deploying capital in small growth stage businesses, we realize we're not alone. There are hundreds of others doing the same things as we. And in fact, I think the whole mantra is written on the poster of the Impact Hub Geneva there, something about collective action. No single one of us holds the key or enough capital to solve any single problem. Not one of those SDGs is achievable if people act solo. And so everything we do and why we do it is to convene. And that is very much the essence of Baraka Impact as well. We're trying to convene and bring together and make discoverable and lift to the surface the great innovators.
Wonderful, so thank you. Boy, you all did such great jobs with that question. Thank you so much. So we're going to focus on three topic areas. One is the whole issue of health systems and how we think systemically and how these innovators are participating in systems change and what it means from a financing perspective to fund initiatives that are targeted at systems and not necessarily at individual populations or individual problems. Then we're going to talk a little bit about the technical assistance that's needed in order to help these innovators be successful. Technical assistance is an evolving field and one that all of these organizations and individuals participate in thinking about. And then thirdly, capital vehicles. How are capital vehicles evolving and what are some of the ideas and experiences that these experts are having as they innovate around capital vehicles? So let me start with the health systems discussion, and I'd like to go to you first, Darren, because when we were talking about this conversation and we brought up the health systems, all you and your team members all said, yeah, that's a great topic. We should really talk about what it means to focus initiatives, investments, funding towards health system improvement. And when I asked you a more probing question about that, you brought up the word community. I said, really, what we look at is community when we're thinking about systems. And I'd like to just turn it over to you and sort of hear both how you personally and how Pfizer as an organization is looking at health system solutions at this juncture.
Sure, yeah, happy to do so. And so the reason I mentioned community, I mean, as we all know, health is so individualized and the context is so important in terms of how people access quality healthcare. And so what we found on our journey over the last 10 years with the Pfizer Foundation is there's actually an opportunity to invest locally at the community level and scale from that grassroots approach. So we have a number of programs that are actually funding local ideas, entrepreneur organizations. They have an idea that's specific to that community. But ultimately, once that can be tested and proven, with funding that can be scaled. So it can have a far bigger impact and more importantly, over a shorter time frame as well. So our approach has very much now focused on how can we make system changes at the community level through investments? And then also, how can we use some of our other resources, and I know we'll come on to talk about this, such as technical expertise with our colleagues, to help the system-wide needs as well?
Yeah, really interesting. I mean, and such a different process to be thinking about community rather than a problem. Very, very enriching. Andre, do you want to jump in on your own thoughts around the system approaches?
Well, I think that there are a number of ways in which we can sort of bring solutions to unmet medical needs. I can perhaps talk about this from two angles, one from my family office and one from our company. Our company, we realized some years ago that we were not going to discover alone the recipe to all diseases on the planet. There's still quite a lot available, and despite our efforts, we're not always as successful as we'd like to be. So we took out a part of our research budget, which, by the way, is the biggest in the industry, and we devoted this to partnering. Partnering started by being, talking to the major universities and to a couple of biotechs, and now it's much broader than this. And I'm delighted you bring forward this notion of community, because if you really want to develop a fruitful dialogue about how you can find medical solutions, you need to engage not only in the community geographically, but also in the community of patients united around the same therapy, the same pathologies. And so the best way to bring this element forward is to try to look at this at a sort of scatter approach. We try to sort of help in a number of different sectors as a company, but we have realized that if we were going to stay as pill manufacturers, somebody is going to come and eat our breakfast or maybe even our lunch. The important thing today is data. It's information point. And the way we use these information points to using artificial intelligence and a number of other technologies to bring it back to an insight is something which we are not specialists at. Our specialty is chemical and biochemical manufacturing. So what can we do to stop other companies coming to us and telling us, guys, from now on you do this because we know it works and you don't need to think about research anymore. That's the end of the business. So we need to be very close to the disease, and that means intimate relationship. I mean, intimate sounds a little bit dangerous, but it means close relationship to health systems. And so we would like to define ourselves going forward, not just as a pill manufacturer, as a vial filler, but as a partner which brings expertise and disease know-how to the health systems. And that's been the bulk of our efforts over the last 5 years. It means a lot of change in the company. You shouldn't underestimate the difficulty for people to think differently, because we've for years have had the opportunity, the attitude to go and tell us that's how it's done. Now suddenly we have to listen, and as we all know, that's not easy to do.
I think it's great that you use the word intimate. I'm a big proponent of it. And listening does make it a more intimate experience. So, I think that's really, really well stated. Audrey, would you care to jump in on your own experiences around that more system-focused type of intervention, and how your own family office, or rather the family office you represent, how they respond to that, or how you see more broadly the investment community that you're familiar with responding to those opportunities?
Sure. The only angle from which I can speak is really from the perspective of a small to early growth stage financier with an impact lens. And again, I state this as representative of quite a large and growing community of interested vehicles and funds and foundations. It's really from that perspective that I think I can address this question of systems. In front of us are sitting 4 entrepreneurs whose collective absorptive capacity is probably, you could absorb about 20 million euros of investment right now. Every one of you has, a couple of thousand, maybe a couple of 100,000 mobile phone numbers or email addresses, data, access to your markets, and only you can have that access to those markets. So from our perspective as investors, it's this question of, well, how do we blanket the global health systems opportunities with enough interest from us and peers, our peers, hundreds and hopefully eventually thousands of our peers, who will care enough to give you that risk capital and some of the support that you require to be able to deliver, and so that we can also see which solutions rise to the surface and what's working and maybe what's not. It's really just from the perspective of discovery, visibility, and we've built a platform to that end to help support just profiling. So that's the systems angle from our vantage point.
Excellent, excellent. You're always good on the ecosystem perspectives. I appreciate it. Shannon, I want to turn it over to you. Same question. But I want to make a comment. You and I have known each other a little over a year now, I think. And when we spoke a couple weeks ago to get ready for this conversation, I found like you've gone through a learning curve in the last year, really intensive. And you take all those brains that you have and you apply them now to these types of questions. And so I'm really interested to hear your current perspectives on some of this system-focused approach.
Yeah, I think, the learning curve has been enormous as an investor. There's a lot of challenges out there. And I think that we need to start talking about some of the elephants in the room, because we all like to really talk about the positive elements, but we need to really tackle the challenges to be able to move things forward. First and foremost, my colleague just said that data is a really big area, and that's true. And with my Health Innovation Exchange hat, data requires connectivity. And so we really look at health adjacent areas as well. That includes building a digital backbone in these countries where there's a lack of connectivity still. So if we want to decentralize care and really be able to meet the needs and bring connectivity to those in rural areas, like one of the innovators working in Rwanda, trying to deliver more pharmaceutical care to these places, then we need to make sure that we have that connectivity in place. The second piece is, from our approach as investors, we really look at, as I said, that hub and spoke model, that systems-based approach in the public sector. So a centralized hospital that's supporting more on the district level hospitals that have a lack of training or that need upskilling, and what kinds of technologies are asset-light health plays. So don't require necessarily huge capital expenditures and a lot of development of kit, but more software type solutions or mobile type solutions that are easy to deploy and really are easy to utilize and can help with this capacity building effort that's really critical and necessary on the ground. But as we started to move into the public sector, we recognize that there's a big kind of misalignment between startups, innovations, venture capital, and their time cycles, and the agency and public and governmental sector. It's very, very different in their timing, alignment, and needs. So we started to understand that there was a great need to focus also on not taking away the public sector, but also on the private hospitals and clinics within these countries. I know that that's a controversial topic. And the question is, do these private clinics serve the most vulnerable or key populations? And equity analyses need to be performed. But I think we need to start discussing bringing them into the ecosystem more. These are places where we can sandbox innovations that can oftentimes pay some nominal fee for these innovations for that sustainability long-term, and can really help to then scale it into the public sector. So I want to bring that to the table, because I think we do need to start talking about the private clinics in these countries as well.
Yeah, I think it's a really interesting conversation, and I've got my own views on that. I'm not going to share right now, but I see Darren like nodding his head to yes to that, and I kind of would like you to jump in on your own perspective there. So, I think we all understand the conversation. We don't want to innovate without the public sector integrated, without the public sector able to meet its demands to society, right? So we all know that. We all know it's important. But what Shannon, I think, is bringing up is perhaps an alternative strategy, an incremental strategy that uses the private sector. And I think it's a really interesting topic. Darren, you had some comments or reaction to that?
Yeah, I mean, it's a very interesting topic. And I think we know there aren't enough resources, right? So we have to use them in the most optimal way. But also we need to recognize that the private sector doesn't have all the answers, right? And so what I like, Shannon, about your answer, and it really builds to the rationale to why we launched one of our programs called our Global Health Innovation Grants, where we actually provide some of that seed funding to small for-profit or not-for-profit entrepreneurial organizations. And it goes back to what I said earlier, is that the important thing here is that these are individuals that are living in the communities that they serve. So they know what the health solution is, and they know how to test that, how to reach people, how to scale that. They just need that funding. And oftentimes they need some technical expertise as well. And they're two things that Pfizer can offer. And it's been hugely successful. And I think where it's been hugely successful is obviously where there is deep partnership with government as well. And that's the key thing here, is it's not just about proving interventions work. It's about, well, how do you use that data and how can you get that into a scalable national system? And so, you know, through all of our work, we make sure any investments that we're making, be it grant investments or other types of vehicles, is that those relationships are also solidified and agreed at the onset. So there is that agreement with the government that if this intervention works, then there is a route to scale and use that data so it can impact more people and hopefully be sustainable.
Thank you. You know, Audrey, did you want to add anything in that? Because I'm thinking both about Movimiento Salud as well as the China Accelerator Program, where, you know, that whole public interface is part and parcel of the models, I think. How are you thinking about this private versus public sector?
Well,
I shouldn't say versus, but you know what I mean.
Yeah, I mean, a big corporation like ours has to dispatch some of its duties in the developing world. We need to make sure that the technologies we develop for the 500 million people who can afford to pay for them is also available to other parts of the world. And the best way to do this is to make sure that you have a two-way dialogue and not just a top-down approach. So when we talk to health systems, and you mentioned two, the one in Brazil and in Argentina. I'm sorry, I'm confusing now. Central America and the one in China. You know, what's important for us is not just to distribute the products; it's also to make sure that we have access to the brains, to the intelligence, to the research institutions in the place. And in particular in China, where chemistry is at a level probably no longer seen in Europe, the idea of building up an accelerator which will allow us to provide young entrepreneurs, but also scientists with ideas which they could then test with us, is important. It's risky, of course, because it's far away. Intellectual property is still an issue sometimes, you know. But I think that if you really want to have a quality dialogue, you need to be doing this at a level where intellectual matters more than just immediate reactions. So I don't know if that was the question you're asking, but for me, as a corporate, our responsibility is not just to be able that our products are available, which is an important responsibility. It's also trying to make sure that we can establish with a new generation of scientists relationship which can help our people suffering here in our geography from the same diseases. So it really is a global approach. Now, if we're talking about private investment, and I understand that, you know, family offices and things like this have to, that it becomes much more a way of providing means which will allow young entrepreneurs to do something. But for big corporation, it also has an element of know-how. It also has an element of technology, an element of sharing. And I prefer the first part than the second part.
Yeah, fair enough. It segues nice into the other topic I said we would get to, which is technical assistance, how that's being offered. I mean, the China Accelerator, and I'll let you hold the mic for a little bit longer just so you could just tell people briefly about that project. It is quite the initiative. Technical assistant writ large.
Yeah, basically what we've done is that we've transplanted some of successful models that we have in California, that we have in Germany, that we have in different parts of the world, to the Chinese environment in Shanghai. We renovated the building and we make it available. In fact, it's a little bit of an impact hub. Yeah, it's an impact hub in the pharmaceutical side, and the idea is to provide young well, I don't know why we always say young. It doesn't matter the age, does it? No. And I mean, people who are new to research to come and work with us, giving them also access to our research team here in Basel, but also in California. And yeah, the first results are very encouraging. I mean, you know, we have nothing patentable yet because it's only been going for a couple of months, but we have high hopes, right?
Audrey, would you jump in on the technical assistance question? I mean, you've been doing this work now for 15 years, and we've had conversations where you've talked about kind of the evolution of needs that are coming from entrepreneurs, you know, and what's some of the trends that you're seeing and ways that you feel like a family office like the one you represent can or cannot meet those needs?
Sure. This is probably the most important topic in terms of the process of engagement and deploying capital. It's understanding what are the needs of those you've just come across on multiple levels. Since early days, I can say from the Indian ecosystem perspective that the quality of the business models, the governance, the strategic thinking, it is on another level today. Or maybe it's just because we have a better network, I'm not sure. Maybe it was always okay. But from the early days, we realized that in some cases, our act of so-called due diligence that would take sometimes, 9 months, sometimes a year, it was actually a proxy for BizDev. Every question we were asking was, oh, we haven't thought about that. Maybe we should think about that. We realized that we had to invest in and take the time to handhold these entrepreneurs and these enterprises. And we were admittedly working at a very early stage, very small ticket end of the spectrum. That said, we now have very well-versed, very professional partners. We work very closely with Mentera Ventures and partners there, Mukesh Sharma, Paul Basil, George Thomas. And they have one of our poster child investments from which we exited within 3 years without wanting to, which is kind of something of a headline for us in our portfolio, was a health business, which they provided support to from its earliest moments. And this was a business called Biosense. Biosense was delivering essentially sophisticated diagnostic capabilities to last mile settings. And when I say last mile, it wasn't really that far. It would take us, 5 hours to drive 60 kilometers on the roads in Maharashtra to get to the clinics where these teams were operating. This business was completely a function of the technical assistance that it was provided by our partners. And we got to go along for the ride, in this case, very bluntly. And essentially, the business was extraordinary in that they catapulted to a level of professionalism and delivery to the point where we had an acquisition. Kleiner Perkin came in through its Indian subsidiary, Tulip, and acquired a business. That was a nice exit for Artha. But it drives home this point that this is not something that's a sidecar. It's not an accessory. It's a core. It's absolutely core to an investment strategy.
Shannon, once again, you made some interesting comments when we talked about this topic, and the particular challenges for private investors and family offices in addressing technical assistance needs. Can you speak to that a little bit?
Oh my goodness, James. This is a huge topic, and this is where Baraka is so necessary. I'm not just saying that to pat you on the back. Basically, there's a deep desire for more classic investors, family offices, and venture capital firms to get into the global South. Not just the typical impact investing firms, but the classic investment firms. And they don't necessarily know how to approach these countries and these sectors. It's a bit daunting for people because, first and foremost, let me go through some of the challenges that we face as investors. And I'm talking to the people in the audience. I'm not sure exactly who the audience is, but if you're agency folks or coming from DFI backgrounds, et cetera, I'm really speaking to you. We have difficulty managing market entry and entirely new environments, laws, currency exchange issues, cultures. There's a lack of unified markets in places like Africa. So imagine each innovation in each company has to go through regulatory environments in each one of these countries. And it's very, very cost heavy to go and do that in every country. So how do we address that issue? Navigating political red tape and volatility in these countries with a lot of the election cycles, et cetera. There's totally different health systems challenges from the global north. So the culture and management of healthcare is different. There needs to be a larger total addressable market to make it interesting for investors to want to come in. So just one country in Africa often is not enough. So how do you make a larger TAM? And we started to think about how do you then connect Africa to India to Middle East to create a larger market that could be interesting for these frugal innovations that are useful in all these countries to be able to then leverage. And then there's very different timelines and cycles, as we talked about, with Global South often requiring more patient capital. And a lot of these funds, their cycles are much shorter. So they'll be looking for exits within 7 years. And oftentimes healthcare is more than 10 years. So these are the types of challenges that we face. And there's a difference in the language that's used between global agencies, governments, and the private sector investors. So they don't have a shared lexicon. And they also don't necessarily have the same incentives. So there's a misalignment in the incentives. And there's a mistrust that's inherently there historically between the two. So while everybody talks about private-public partnerships and it's needed and SDGs and actually creating the environment and ecosystem to translate between these sectors and make sure that the timings are aligned and all of these things are the technical assistance to do this is present is challenging. So we need these sorts of groups like Baraka that are going to be sitting in the middle, helping for investors like myself, making it easier for us to enter the market.
That's a great set of comments, and I love the Baraka plugs, so thank you.
Sorry.
But, Darren, once again, I notice you responding, and I'm going to give you a task, Darren, to build on this technical assistance topic, because you made some comments already about that, and I know that Pfizer, that you particularly think a lot about this. But then also, let's move it into the third topic, which is capital vehicles. Because that really, I think Shannon's conversation ended up touching on that as well, of course. So if you don't mind, can you take that baton?
Sure, yes. I mean, I could talk about the technical assistance piece all day long. And, it's exactly what Shannon said. We need that lexicon, and it's exactly what Audrey said in that this is fundamental, this is core. And so what we do at Pfizer, and what I'm really proud about is, we have more than 70,000 people around the world who work for Pfizer. A variety of skill sets, capabilities, including those softer skill sets, James, that you spoke about earlier. And so what we do is say, well, how can we use this expertise and how can we place this expertise with these organizations to actually help enhance what they're doing through pro bono technical expertise? And so we've been doing this for nearly 20 years now. And what's been interesting is how it's evolved over the last 2 years and optimized in the current environment that we're working in. But what we do is we work with either international big NGO organizations or more so now smaller entrepreneurial organizations who might not have the skill sets necessary to do some of this scaling or to do some of the M&E work. And we place our colleagues to work side by side with them. Now, this originally was going in country and working with these organizations, but now we're able to do this virtually, which is, it's one example of how we can scale this really quickly. And we have the ability to really flex now with this virtual environment to address some of those strategic challenges that many of these organizations are facing.
And that's a whole nother session to talk about what is virtual. It's really, really interesting to me that you said that and you're so confident in how you portray it. I think you're right, but that's a whole nother topic. I'm going to actually take this capital vehicle question, Audrey, to you, and what you think's possible and what you think needs to happen in terms of generating more capital opportunity for these entrepreneurs in multiple developing markets. Can I hand you that?
Sure.
Thank you.
I think that we are at a remarkable cusp, a remarkable moment in time. we've brought to this edge because of the experience of COVID, understanding that the way our behavior as investors, our mindsets, the consciousness that drives some of the strategies, all of this has to shift so that we can begin to operate at scale and start scaling the solutions that need to be scaled. I think the challenge remains that I mentioned it before, there's all these wonderful, sophisticated capital stack strategies within fund vehicles, and every day, every week, we'll hear of another fund, and we applaud every one of those initiatives to formulate and find the LPs and raise the money or launch the program. It's all, these are the critical cogs in the wheel. But if we do step back and think about systems level coordination and financing, the entrepreneurs that are the guys on the ground with their sleeves rolled up, making immense personal sacrifices and carrying huge burdens in essence to do what they do, we have to make it easier for them to find who they should be talking to. And in this day of digital technology and the internet, which supposedly bridges digital divides, it's still shockingly difficult. Given the concentration, I heard yesterday a statistic that made me scratch my head a little bit. Apparently, 1/3 of impact finance flows through Geneva. If that were the case, I'm not sure we'd need to have Building Bridges Week. I'm not sure if that's a function of widening the goalposts of the definitions of impact finance, or if in fact it's all happening and maybe we just don't see it. But it feels like the burden is still very high on the shoulders of these entrepreneurs and innovators. It feels like we can do better. And from an ecosystem perspective, I come back to Baraka, we're just trying to make things visible. In the same vein, if you can measure you can manage what you measure, you can only scale what you see. So we're going to try our best to raise to the surface those that are working in their respective regions and in their respective continents to be able to facilitate more equitable flows of financing and better access.
Thank you. Audrey, I'm very curious, either from your family office perspective or from the corporate perspective, how you're looking at the evolution of capital vehicles that will support health innovation in underserved markets. What are some perspectives you have? I don't know that you and I talked that much about this in preparation.
I'm sorry. I think this is two or three things from the previous intervention come to my mind. This idea of frugal technology, the idea that we need to identify products which countries like the ones we're discussing today could bring to us to benefit to our system. Our healthcare system here in the rich north is too expensive. We need to bring the costs down. And to bring the costs down, we need innovation, and the real innovation that we can get and import it from developing countries is this frugal innovation, which I am very much in support of. Now, please, let's not overcomplexify the issue. We need to scout for good ideas, and we need to make sure that we support them. That means we need to go out and find these different. It's wonderful that our 4 entrepreneurs came here and presented in Geneva. It's even more exciting to hear that 1/3 of impact investment. By the way, we need to define impact investment. That's maybe another conversation. The fact that you have been sufficiently resourceful to find financing here is exciting, but it is our duty to go and find out the new ideas, to seek out the new ideas, and to ensure that these ideas have an opportunity to develop. So I think, as far as the vehicle is concerned, it's horses for courses. We lucky enough in a family office can invest our own funds, so we don't need limited partners. We don't need layers of performance. We don't need incentives. We just go and do what we think is important. And for that, you need access, and access is a relationship with the local healthcare system. So I come back to this definition of partnership with healthcare is more important than just behaving like an exporter or an importer of products.
Point well taken. I've been given a 2-minute warning. I want to just turn it over briefly to the audience and see if there's any questions. Please, yes, I can't see you very well, but I see your hand up.
Thanks so much. So my question started really at the very beginning when you mentioned this idea of system innovation. And I was so curious how everyone would approach it. And there's one angle that I think can complement all the great angles that was mentioned, which actually startups are working on system innovation themselves. So the first question we get asked as startups is, what is your product? And it's very annoying for us because we have to shift the narrative that we are not a product, we're not a service, we're in fact a solution in a multi-sided market with multiple stakeholders. So how do you approach this situation? And how do you finance this? Because the risks are very different. How do you, anyway, so that's the question, thanks.
Yeah, so I mean, I'll briefly, I'm in that situation myself all the time. So, I mean, being in a situation where you've got to explain health systems, and I think, we do all have an advantage because of what's just occurred on the planet with the pandemic. There is more understanding than there was 2-3 years ago, but I think it's a tall order. I don't know. Do you have thoughts for how somebody who's got a system solution can quickly convey that, can quickly share it? Shannon, Darren?
I'll just add that it would be really quite useful for us to have dedicated investor workshop sessions identifying those who are ready to fund the ecosystem, to fund system solutions. There are very few. And that's, I think, the problem that one hits the wall quickly. And it's got to take, I think, a collective effort to identify these institutions. They're out there, I believe.
Yeah, and I'll just add, it brings back to the point, James, that you said at the beginning, the last 2 years, we now have this moment where the public understand the need for health systems and how everything is so interconnected. So the time is really now to be able to look for those different sources and as the question said, serving up a solution versus a product and why that's important.
Right.
Yeah, and I would also add to that, from an investor point of view, it is hard because people look very siloed, and now we're starting to look at much more integrated type systems. And we often see companies that are coming out with things that are almost like business units. They're tackling an entire multiple vertical type thing. And that's exciting for the investor because that's multiple revenue stream potentials as well. And so you really have to share what the opportunities are with the investor that, talk about it differently. Maybe it's a business unit strategy. Maybe it's a multiple vertical strategy, and show them where their opportunities sit because you're looking at it from a systems perspective.
That's great input. Andre, you wanted to say something on this? No.
I mean, system change is not something that's only limited to health. We need to change our existing system. The operating system doesn't work. And so, how do you change a system is something I would love to have a seminar on. If we could spend a couple of hours, a little step at a time. Is that going to be fast enough? I don't know. But we really do have needs for some gray cells in that respect.
Yeah. Other questions? I can do one more.
Congratulations in general. Just two short questions. One, now that we are collecting so much data, Andre, to your point, we have such a great data collection database nowadays with these passes. I mean, we're collecting a lot of information. Is there a collective approach on an industry level to use that data in the benefit of all stakeholders rather than specifically collecting data? That's one question. The second question, in terms of capturing impact investments, I'm doing a project and I'm struggling to find the investment because if you go to the fund managers, they tell you basically that they only do stock listed allocations. Is there a global framework, or could there be a global framework where you can identify projects that are more greenfield but have some metrics that ultimately can help identify those projects?
Okay, quick.
So in terms of data, you need three things. You need lots of them. They need to be of good quality, and they need to be accessible. And I know very few places where this happens. Maybe China, perhaps Singapore, the US to a certain extent, but you still have some conditions. The conclusion is quite clear. We in Europe are very much backward in that respect. And this is not because the industry doesn't want to play a ball, it's because the regulation does not allow it.
In the second question, you were...
Actually, a quick point to the data question.
Please, yeah.
Yeah, I was actually, I had the opportunity to moderate a panel at the Global Center for Security Policy yesterday, showcasing a concept that Arthur Wood from Total Impact has formulated called equity for humanity. And I'll just plant the seed here and end with this. The idea is that the beneficiaries and the communities become stewards and owners of their own data, and that data is what informs the valuations. The experience of the users is what forms what the value of the companies are that we as investors are investing in. So there's all kinds of interesting systems thinking at the moment underway, and happy to share more information offline.
I think we're going to have to wrap it up. So Shannon Shabata Germano and Darren Back and Audrey Sanghi and Andre Hoffman, thank you very much for the conversation today. Excellent. There's so many more we could do after this. So
Excellent moderation.
Thank you, James.